Hi guys, thank you for responding on my past Google form. Today we will be talk about control your plate, control your glucose. This educational video explained that the risk of diabetes mellitus and prevention using nutrition and metabolism concept. Why diabetes is matters? Because early nutrition education can correct the misconception before risky habit become the routine. We have a three golden rule, which is know, choose, and move. We should know how glucose and insulin work, and we should choose the balanced milk and the suku sparrow. I think you guys have been familiar with it. The third is move to improve insulin sensitivity, and the goal of these three golden rule is to improve diabetes awareness, attitude, and health dietary practice. And you guys know 15.6% of Malaysian adults with diabetes having suffering from diabetes, and 5.9% of people had raised blood glucose but were not known diabetes. I mean, they are not aware of it. The selected disease we are going to discuss today about diabetes mellitus. Diabetes mellitus means the blood glucose stays too high because the insulin is absent, insufficient, or not working well. We will be focused on three main things, which is type 1, autoimmune destruction of insulin producing pancreatic cell. Type 2, insulin resistant plus gradual beta cell dysfunction. This will be our main focus of today. The third one is gestational. High blood glucose first recognized during pregnancy. It's mostly considered on the pregnancy woman. The important prevention advice mainly applies to type 2 diabetes risk reduction, not type 1 diabetes. As you guys know, if we are talking about the diabetes, we will be know how the diabetes came in simple word from sugar. But sugar is not only about the table sugar, which is white color or anything. It's also about the carbohydrate, which mean the rice, the flour, the noodles, everything is carbohydrate. We should know the carbohydrate metabolism and blood glucose. For this, I have been provided four golden rule, which is digestion and absorption. Starch is broken into glucose and absorption. Glucose enter the blood from small intestine. And third and for this, the insulin and the energy storage. Pancreas releases insulin when the blood glucose rises. And for the energy of storage, cells use glucose for ATP or store it as glycogen. Okay, you guys should understand this actually. For the digestion and the energy production, actually we can eat sweet, but as we should equalize it by the activity. That's why our ancestors are very eagerly all the food they are created. Our traditional food will be involved with pure sugar. They will be like dip in syrup or many things, but they do the work equivalent toward the sugar intake. But nowadays we are taking the traditional food which are additionally added sugar, or the original recipe have been modified with more sugar, more thickening agent and anything, but we are consuming it, but we are not hardworking as them. This is the problem when high blood glucose level in our blood, but the insulin is not supporting because we never use the ATP from the glucose production. Let's refocus on the insulin resistant in type 2 diabetes. When the cell respond poorly to insulin, glucose remain in the blood. Okay, when we can see the illustration have been given here. One is normal, one is insulin resistant. Actually, the concept is very simple. Don't need to confuse. These are the both demonstration what happening in our body. When we are seeing the normal, the glucose level are normal. When we are seeing the insulin resistant, the glucose are hyperly there. And then in the normal, the insulin receptors are receiving the insulin from the pancreas, and also the glucose enter the cell. Then they both do a process, and then the glucose is turned into energy. But in the insulin resistant, receptors are not accepting the insulin from the pancreas, and the less glucose enter the cell, and it cannot be do the process, and the ATP conversion is never happen efficiently. Then it become glycogen, it become fat, and also the insulin production slowly stop. This is the reason of we are getting the type 2 diabetes, and it might result on persistent hyperdiaglycemia, may damage blood vessel, nerve, kidney, eyes, heart over time. As per you guys know, we always have some relative who are affected on eyes, kidney damage due to diabetes. You guys should know this. You guys should aware on this. For the dietary intervention, build a glucose-friendly plate, Malaysian healthy plate, which is suku separuh, which is quarter and half. The vegetable and fruit should be the half, protein should be quarter, the carbohydrate should be quarter. Sweet drinks have to be replaced with water. This doesn't mean we cannot take sweet waters. Life will be very boring, right? We can take sweet waters, but not very oftenly we should take, like a month, a month once, a month twice, maybe after taking the sweet drink doing a bit of physical activity than usual. That's normal. I'm not saying that we should not take sweet. As a human, we have a life to enjoy, but we should do it efficiently. How to We should great in plan, how to plan our plate today. We should do that. For the risk factor and lifestyle prevention, we should change the physical inactivity. We should every day do a simple activity like a walking, better late than never. We should do something. And then the sugary drinks, as per I told before, we should lower the amount. Not I'm saying we should cut off everything. Low fiber intake. Actually, fiber are helping to our gut health also in this process, and also fiber makes us feel fully, and then it makes to reduce the cravings of sweet items and excessive energy intake. We should know if today enough of this sweet, if we are taking some sweet, after that no, don't need to go to buy any sugary drinks or dessert. Plan accordingly which day you want to intake what. Don't overly take excessive intake, and we should avoid the overweight and the central fat. And what we cannot change in diabetes, family history. If for example my father got diabetes, mean I cannot be change that, but I can change what I can change. And then the age factor. If you guys already 40, 50, you guys have to be very careful on this matter. And the previous gestational diabetes, if you guys before this got gestational diabetes, we cannot change that, but we can control it. That's all from me. Thank you. As a closing towards the video, three action after this video should you guys consider three golden rule, which is control the portions, choose quality, move daily, control your quarter plate carbohydrate, fiber, protein, water, a quality ingredient, and also move daily, reduce sitting and exercising daily. That's all. Bye bye.